Meanwhile, the province is expanding its vaccination passport. Starting Tuesday, it'll be required to enter a government liquor or cannabis store. Later this month, it'll be needed for big box stores too. And there are still questions about another unique Quebec plan to tax unvaccinated adults, including whether it would even work.
People, when they're pushed into a corner and they have pretty strong belief, and certainly a belief that's being driven by fear, the harder you push, the more they're going to dig their heels in, the more they're going to resist.
Vaccines lead to mandatory vaccinations, which lead to forcibly vaccinating people. Well, the Quebec government isn't planning on using physical force just quite yet, but they are planning to hit the unvaccinated right in their pocketbooks.
Remind people that it's never too late to do the right thing.
Today, we have news out of Quebec. Authoritarian leader Legault has been warning people that the unvaccinated are clogging up the hospital systems, and now he's going to make them pay.
François Legault, bienvenue à Tout le monde en parle, Monsieur Legault.
Tonight on the French-language talk show Tout le monde en parle, Legault defended his plan. Legault says if Quebecers refuse to be vaccinated, putting a huge burden on the health network, he thinks it's only right that they should pay a contribution and that Quebecers agree. He says he plans to submit the bill for debate in the National Assembly in early February.
New health contribution that will be required.
So we do not know what the fine will be just yet, but we do know the Premier says it will be significant. When asked about the amount, the Premier declined to comment, but he did say $50 or $100 is just not enough. We're in dangerous times, folks. This is all part of their plan, taking a little bit of freedom here, a little bit of freedom there, from those who, they're the outcast on society right now. But it's setting precedent for decisions down the road that will most likely affect the general population. And there's a lot of commotion online, it seems, even from the double vaccinated. They themselves believe this is a bad idea. Because what happens if you did your part, you got your 2 jabs, and you don't want to play their games anymore, you don't want to put the into your body? Well, guess what? They changed the definition of fully vaccinated. If you're not up on your boosters, you're unvaxxed. You don't want a booster? You're an anti-vaxxer. This is all part of their plan. So the double vaccinated will now start getting the fines as well. And in tough economic times, who can pay these outrageous fines? Well, there's going to be a lot of hardship. And this is what they want. You're back on your fines, you can't pay them? We'll take your house. We'll take your car. Maybe that will get you up to date. Buy you some more time. Or get the booster.
But I do want to talk a little bit more about Quebec's proposed tax on the unvaccinated, which is really just a backdoor way into a vaccine mandate. I played the clip in the last show. I have to play it again. Jean-Yves Duclos, the federal health minister, has said that he thinks provinces inevitably will go down the road of mandating vaccination. Take a look.
First, it's a view which is based on my personal understanding of what we see internationally and domestically, and in my conversations with my colleagues, health ministers, over the last few weeks. And second, it's a decision that will be made by provinces and territories at some point. Whether they move forward or not, that's going to be their decision to make. But what we see now is that our healthcare system in Canada is fragile. Our people are tired. And the only way that we know to go through COVID-19, this variant and any future variant, is through vaccination. PPE, physical distancing, tests, rapid tests, PCR tests, these are all very important tools. But what will make us move through this crisis and end it is vaccination. And I see in my own province, 50% of hospitalizations now in Quebec are due to people not having been vaccinated. That's a burden on healthcare workers, a burden on society, which is very difficult to bear, and for many people difficult to understand. So that's why I'm signaling this as a conversation which I believe provinces and territories in support with the federal government will want to have over the next weeks and months.
You're going to be seeing a lot of that clip because it is such an important one. The federal government deciding that it's up to the provincial governments in this country to figure out whether you should get vaccinated, not your own choice. That's basically what he's saying there. And when Quebec says, okay, what we're going to do is we're going to make you pay if you're unvaccinated, they're not mandating it because, again, they're saying, well, you still have a choice. You can choose to not get vaccinated. You just have to pay for it. But what they're doing is they're further stratifying societies. The vaccine passport was bad enough. They're saying that's nothing. Wait till you see what we're going to do next. And in Quebec, when they put this forward, if you are not vaccinated, you will have to pay extra. And how the government is rationalizing this is by saying that, well, your burden on the healthcare system is, if you are unvaccinated, higher than if you're vaccinated. So they're trying to basically say that you have to pay for what the government says is your increased share of the healthcare system. Now, this is where the thing will die. A lot of the criticism that this has gotten from the left, for example, NDP Member of Parliament, I think it was Don Davies, had said that he doesn't like that this would compromise the universality of healthcare in Canada. It's not, well, I think it's wrong to judge people based on their vaccination status. It's, well, we can't do anything that steps on the toes of universal healthcare. But hey, I'll take opposition to this however we get it. I think what the government is aiming to do is put forward a policy that seems unintrusive, that they can pretend is not intrusive, that they can pretend isn't just trampling on your right to bodily autonomy and your right as an individual to make these decisions. And they're saying, well, we're going to do it in the tax code. So that's how they're getting around the enforceability problem. This might be something that is on your income tax return. So either you have to declare vaccinated or unvaccinated, or perhaps Health Quebec records are being sent over to Revenue Quebec, which raises a host of monumental other issues, because what happens if we start taking this actuarial approach to healthcare in general? So the idea that these taxes are only tied to the healthcare system is just not accurate. And let's look at, I don't cover sports at all, but let's look at someone like Novak Djokovic in Australia, a guy who was held up in some immigration detention gulag because he wasn't vaccinated, even though he had natural immunity. Novak Djokovic is, despite being unvaccinated, probably healthier and more fit than, not probably, he is healthier and more fit than most people in the world. So I would take an unvaccinated Novak Djokovic and say that he is going to be responsible for less healthcare expenditures if he were in a public system than a fully vaccinated person who has another lifestyle. Not even someone who's just, like the opposite, but even someone who has just an average size, average health concerns and all of that stuff, average level of fitness and diet. So he's going to be less burdensome. But he would still be subject to that tax. He would still be subject under the Legault idea, irrespective of how much or how little healthcare he or anyone else uses. People have to pay the tax if they're unvaccinated, and they don't have to pay it if they're vaccinated. But it's a backdoor into trying to make it so that healthcare is no longer the public good that Canadians have, generally speaking, affirmed they want. Now, by the way, I am totally for an overhaul of the healthcare system. I find Canadian healthcare is terrible. I find it is something that we cling to despite its shortcomings, and we deliberately delude ourselves into thinking that it lacks the inferiority it does. Now, I'm not proposing replacing it with the U.S. system. There are a host of other systems around the world that do better than both Canada and the United States and take less money to do it. Nevertheless, I'm saying that right now, if we're going to have that healthcare discussion, let's have it consistently. So I do think there are both left-wing and right-wing premises that can be used to defeat this legislation. My position on this is that all of these things are secondary. The most important one is that we should not be stratifying society. Government should not be using coercive measures to mandate anything along the lines of a personal healthcare choice, and that is up to and including vaccination. So it is just wrong. And you could talk about, well, is it equal? Is it fair? Is it reasonable? I mean, all of those are fine. They're questions you can litigate, but they're political questions. The fundamental moral question is, does the government have a right to coerce vaccination? The answer is a resounding no. We're not talking about whether it's effective. We're talking about whether it's right or whether it's wrong. Going door to door with needles and just tying people down who are unvaccinated and jabbing them, that's a very effective way to do it. That's totally effective. It'll work. It'll get people vaccinated. That doesn't mean it's right. And that's the danger here, is that there are a lot of people that think what Francois Legault is doing in Quebec are hunky-dory, and they'd like to see other provinces doing the same, because people will consent to their own oppression. People will consent to a regime that tramples on their individual rights if they don't think it affects them. My goal on the show is to try to tell people who don't necessarily see that yeah, it does affect you. Even if the specific circumstances don't affect you, the precedent will. The precedent will. And by the way, I don't even think the precedent is that far off here, because if Francois Legault's regime is applying to 3 doses, it's very likely that when we come time to get our 4th doses, this is now there, and someone who has doses 1, 2, and 3 is facing the unvaccinated tax if they don't get the 4th dose. So even if you are triple dosed right now, this could very easily affect you if the boosters become as perennial and permanent as they're certainly feeling. I think it's in France where they're talking about boosters every 4 months. So triennial or triannual, I always get the two mixed up. Triennial or triannual boosters in France. Maybe it's just quarterly elsewhere. Who knows? Maybe it's down to monthly. That's the direction it seems like we are headed. So I feel and I fear that it is politically saleable to start throwing up all these hurdles and roadblocks and restrictions on the unvaccinated, who are a minority group. I mentioned in my newsletter last week that government right now has no choice. Government's legitimacy is absolutely shattered. So it has no choice but to try to find a population and scapegoat it for their problems. And for Justin Trudeau, that's the unvaccinated. For Francois Legault, that's the unvaccinated. They're looking at this group and saying, well, don't look at us and our advice that was wrong and our bungled border closure and our mismatched guidance and flip-flops on masks. Don't look at all that. Look at these people. Blame them. Blame them. Blame them for it. All the problems you have, all the lockdowns, it's not us, it's them. Premiers are doing this. They're saying, no, we didn't lock you down. These people locked you. We only did it because they made us. These people over there are the problem. And it's working. It's working. This division in society is working. Government leaders are sowing this division, driving wedges between the vaccinated and the unvaccinated, because they are trying to and succeeding at scapegoating unvaccinated people for their own public policy failings. So what we're seeing from government now is this insistence that we're going to blame this group, yet also deny them the right to just do what they want after 2 years, which is the hallmark of being in a liberal society, that the individual is sovereign. Your body does not belong to the state. Your body belongs to you. And to go back to that polling for a moment, like I said, I fear that's correct. I fear that we are headed towards a period where most Canadians would quite easily throw their own liberties under the bus just to spite their neighbor they may not like.
Will your government provide an actual card or proof of vaccination? And if not, why not?
Well, I've never believed in proof. Everyone gets their proof when they get the vaccination. You're right. Anything can be fraudulent, right down from money to certifications. I just, no, we aren't doing it. Simple as that. But the answer is no. We aren't going to do it. We aren't going to have a split society.
And yeah, so he said that, and here we are. It is January 2022. The vaccine passport exists and still exists, even though it was supposed to be gone by now. So I am not relaxing and resting on my laurels when all of these politicians across the country say at this particular moment in time that they don't plan on doing what Quebec is doing. They don't plan on doing what Jean-Yves Duclos is doing. I said last week, politicians need to be standing up loudly and denouncing it, not just saying we're not doing it. But we are not, we are never, no one should ever do it, and if anyone does, they should resign and actually start putting some stakes there so that if they go back on it, we can tell them, hey, you made a promise. I'm not optimistic of it, but that's what I would like to see emerge from this.